Hello and welcome to Nursing Bites by Nadia. Let's switch gears a little bit and do some pharmacology. Let me give you a brief overview of ACE inhibitors today. Examples of ACE inhibitors are benazepril, enalapril, lisinopril, ramipril, fasinapril, captopril. Basically anything that ends with a pril, you can be pretty sure that it's an ACE inhibitor. They're well absorbed orally, produce an effect about 1 to 1.5 hours after oral administration. The drug is excreted in the urine. In addition to hypertension, it's also indicated for treatment of proteinuria in patients with diabetes as well as renal disease. ACE inhibitors block the enzyme that normally converts angiotensin 1 to the potent vasoconstrictor angiotensin 2. By blocking production of angiotensin 2, the ACE inhibitors decrease vasoconstriction, thus producing vasodilating effect, and decrease aldosterone production, and by doing so, reduce retention of sodium and water. In addition to that, ACE inhibitors also inhibit the breakdown of bradykinin, prolonging its vasodilating effects. ACE inhibitors are used to treat heart failure and hypertension. They may be effective as monotherapy in Caucasian patients or in combination with a diuretic in African American patients. ACE inhibitors are also recommended for patients with hypertension and diabetes and subsequent kidney damage and albuminuria. ACE inhibitors improve post-MI survival when added to the standard therapy of aspirin, beta blocker, and thrombolytic. Usually, ACE inhibitors are well tolerated. They have low incidence of serious adverse effects, such as neutropenia, agranulocytosis, proteinuria, glomerulonephritis, and angioedema. It is very important to know what angioedema is. Angioedema is a sudden deep swelling or welts under skin, particularly around eyes and lips. Such occurrence is an emergency and has to be reported to the treating physician immediately. Expected side effects of ACE inhibitors, which often pops up in NCLEX questions, is persistent dry cough. It develops in significant number of patients. Of note, the cough can develop years after initiating the drug or after several first doses. Hyperkalemia is another side effect that may develop in patients with diabetes or renal impairment, or those who are taking NSAIDs such as ibuprofen, or in patients who take potassium supplements. Please note that patients who use salt substitutes, which are mainly comprised of potassium, also have increased risk of hyperkalemia. Use of ACE inhibitors is prohibited in pregnancy due to injury or even death to a developing fetus. Additional contraindications include allergy to medication or prior occurrence of angioedema. Nursing implications. You may crush the tablet for patients who cannot swallow. Monitor the blood pressure before and after administration to assess for effect. Assess for adverse effects such as acute hypotension upon initiation of drug therapy. Check serum potassium levels prior to administration. If the patient's potassium level is already high, please make sure to consult a pharmacist or physician prior to administration. This concludes today's brief overview of ACE inhibitors. I'll speak about other hypertension antihypertensive medications in the next videos. If you'd like to see something in particular, please comment below.